So next up, we have Christine. We're very happy to have her also here today. So Christine is a strategist and technical lead for infodemic management within the Infectious Hazard Management Department at the WHO. She supports countries in emergency preparedness and response to address the COVID-19 pandemic, infodemic, and emerging health threats. So we're actually really happy that she can be here today. She's currently very, very busy because she's leading the WHO training course that's happening about infodemic. And yeah, we're very happy that she's here to explain some of the main concepts of what infodemic management is, and happy to hear what she has to share about that. So over to you.
Great. Thanks very much for the introduction, Petronil, and hello, Tina. Nice to see you here, and warm welcome to everyone, and thank you to the PHIRI team for organizing this. So Miriam, are you going to do the screen share? While you get that pulled up, I just wanted to share that I'm delighted to be here today so we can talk about how we can move this emerging discipline of infodemic management forward to ensure better access to credible health information and better health for all. And thank you, Petronil, for sharing that little bit of history. Well over a year ago, the World Health Organization Director General raised the alarm about the twin challenges of fighting an infodemic whilst also fighting an epidemic. And before we go to the next slide, I want to throw out a quick question, and this is on Mentimeter, I believe, so you can tell me if that's up there. So everyone can go there now, enter the code 42183067, and answer the question, what is an infodemic? So what is this term? You hear it thrown around a lot, an information epidemic or infodemic. So what is it? Tell us. Let's see what the answers are. So do we have sight of what's coming in terms of the answers? I'm really curious. Fake news, overabundance of info, non-accurate information, a tsunami of information, wrong information, misinformation. Yeah, good answers coming in. Really great. Oh, and an epidemic of information. Yep. We've got more answers coming in. Okay. Good. It's wonderful seeing everyone engaging too. Oh, bad information also came in. Yeah, misinformation epidemic. Yeah, really good answers coming in. Okay, so I think we can go to the next slide in the deck, and I can share that an infodemic is about much more than misinformation that can quickly fill information gaps, as some of you alluded to. It's also about people struggling to find helpful advice when there's an overwhelming amount of information, and some people picked up on that overabundance of information point, as well as the challenge of information gaps and confusing messaging that altogether make it difficult for everyone to know what to do. And I'm curious now, let's do one more quick Menti test. Do you know the difference between misinformation and disinformation? So go to menti.com and put in your answer. What is the difference between misinformation and disinformation? And let's see what people come up with. Feel free to pop in any answer that comes to you. There's also malinformation, which is using true information in a malevolent way to cause harm. But really right now we're focusing on misinformation and disinformation for the moment. Purposeful, intent, disinfo, deliberately spreading misinformation. Disinformation is deliberately done to misinform people. Okay, disinfo, wrong info with a purpose. Misinfo is deliberately bad. Okay, so we're split in terms of what we think they are. So, okay, so we're all on the same, oh, we've got more answers coming in. Misinformation, wrong information, not knowing. Okay, really good to see all of the thinking here. So quickly, focusing on misinformation and disinformation, both of them are essentially false or misleading information, but the difference is that with disinformation, there is an intent to cause harm. And disinformation campaigns can include inauthentic voices that are driving an agenda, think bot farms, for example. So now that we've covered that, the problem with disinformation campaigns and circulating misinformation is that they can generate confusion that can lead people to ignore public health measures and take risks that can cause serious harm. And Miriam, if we can go to the next slide, I expect we've all heard the tragic reports this past year of people being poisoned by drinking methanol or improperly using cleaning products. And there's been polarization about basic public health and safety measures, such as wearing masks or getting a COVID-19 vaccine. Next slide, please. So we need to better manage the infodemic in order to save lives during health emergencies, to build and maintain trust in health authorities and health measures, to keep trust in science and in journalism, to reduce susceptibility to misinformation, and to ensure universal access to credible health information so that everyone can make more informed decisions about how to protect themselves and each other. Next slide, please. So how did we get into this infodemic in the first place? Well, our communication ecosystem of today, it looks a lot different than it did 100 years ago during a flu pandemic. So advances in digital media, we know they're making it easier than ever before to rapidly share unverified content. But we can't simply point fingers at digital platforms because they're also providing new ways to share good information and expert advice to help people. Though, of course, I think we're all on the same page that there's still a lot of work to be done together to improve transparency and protect people from harms in that space. But this problem of rumors and conspiracy theories, it's not unique to the digital space. There's a long history of people sharing harmful narratives that are counterproductive to public health measures. For example, one example I can think of, there was a cholera outbreak in the 1830s in France. And obviously there was no internet or social media platforms back then, but there was still this conspiracy theory that was circulating offline about the illness being caused by doctors trying to poison the working class. And so what this tells us is we know that it's impossible to prevent an infodemic and the misinformation and disinformation about health measures that can accompany that, but we can better manage them. And so this means we need to better manage our entire communication ecosystem, both online and offline, to ensure universal access to credible health information as a basic human right. Next slide, please. So how do we do this? Well, infodemic management, it's a field of practice that has coalesced a variety of different activities into a framework approach to improve pandemic communication, community engagement, and evaluation of the impact of infodemic management interventions. And we know that countering the infodemic, it depends on approaches that are grounded in science and based on the principle of doing no harm. Now, the science of infodemiology is key because it underpins this commitment to evaluation and delivery of impact, whereby better listening to the questions and concerns of citizens is really at the core of this work, because public health is truly a collaborative endeavor. Next slide, please. So here's a nice opportunity to call out to keep your eyes peeled, watch out for the journal special issues on infodemiology that WHO is supporting to come out this year. And in fact, the special issue from Big Data and Society just dropped, so make sure you look out for this for really exciting reading on how to tackle the infodemic and how to advance your infodemiology skills. Next slide, please. And to help accelerate investment in the development and testing of new tools and techniques in this emerging discipline, WHO, the World Health Organization, has gathered experts from 20 different disciplines from around the world to develop this public health research agenda for managing infodemics. And there are key questions here that we need your help to answer. So for example, how is exposure to misinformation and disinformation online influencing people's behaviors in the real world offline? And there's a lot of debate about whether to focus efforts and resource on debunking so that's countering misinformation, or to focus more effort on pre-bunking, which is inoculating people against a weakened form of the harmful narrative in the context of the truth, or trying to more proactively and rapidly amplify credible health information to plug those gaps in understanding before people are exposed to the harmful narratives. And all of these approaches, they have their place in the infodemic manager's toolkit, but more research is really needed to determine when to use what approach and how to make it most effective. So thinking about the challenges that we're facing here with the infodemic, throwing science at people isn't necessarily going to help them make the best decisions. So in fact, when an issue has become especially politicized and is polarizing, as we've seen for other topics such as the climate crisis or biotechnology, we've seen a failure of the knowledge deficit model of communication. And this is the idea that if people have the right information, then they'll take appropriate action for the best outcome. But information, it gets filtered through our unique worldview. And when there's this strong disconnect between what we value and that information, there's this temptation to disregard the evidence or advice or to cherry pick from it. Next slide, please. So I'm going to take this opportunity to plug the WHO Global Science Communication Conference that kicked off on the 7th of June, and I invite everyone to register and take part. It's still ongoing until the 25th of June. And I also want to add a caveat here that, in addition to advancing our science communication capabilities, there's also a need to invest more in behavioral science so we can address the bigger picture rather than only knowledge deficits. So we know that trust and relationship building are key, and behavioral science can help us identify ways to really establish common ground in a rapport to facilitate more meaningful dialogue that will help people open up to these new ideas without feeling threatened. But it's also really key because it helps us identify major barriers to good health practices so we can create a more enabling environment to empower stakeholders to take positive action. Next slide, please. So all of this research feeding into the science of infodemiology and the practice of infodemic management, it needs to be integrated into our health security preparedness and response plans so that in future, we can more rapidly flatten the infodemic curve, which you see here, in order to help flatten that epidemic curve. And this will help us more quickly tackle new and resurgent health threats in future and ensure better understanding and utilization of health interventions such as vaccines. And so what this means is we need to invest more in our really advancing our monitoring capabilities with more sophisticated social listening approaches to better understand the spread and the impact of an infodemic, and also to better track changes in narratives over time and better engage communities, because this is what's going to help us more effectively tailor our public health response for better resource use efficiency and for better outcomes. And we also need to strengthen the ongoing evaluations of public health and social measures so that we have strong feedback loops in place for a more adaptive response, essentially, that's tracking the changing concerns of communities. So now you might be asking yourself, what does this all have to do with me? Well, COVID-19 is affecting all of us, and the infodemic is affecting how well we can move out of the acute phase of this health emergency. And let's take the case of vaccines, for example. So vaccine research and development is absolutely vital for humankind to protect ourselves and animal health in this evolutionary race we're in with pathogens. And global trends suggest that we are seeing overall greater demand for COVID-19 vaccines right now than there is supply vaccines available, which is creating a serious vaccine justice challenge and equity issues. And this is why the World Health Organization Director General supports the temporary waiver of intellectual property on COVID-19 vaccines to upscale vaccine production to help end the pandemic as quickly as possible. But this high demand for COVID-19 vaccines that we're seeing right now is really under threat from harmful messaging that's intended to make people wary of them or to sow confusion by misrepresenting them. And it's important to be clear that people do have genuine, questions and concerns about the vaccines, which are reasonable and all part of a rational decision-making process. And these need to be heard and these need to be answered. And these information voids, we need to move to fill them quickly with credible information before they're filled with harmful narratives, which is why social listening to quickly detect these information voids is so important. Next slide, please. We know our communication ecosystem, though, is getting polluted by confusing and harmful messaging about vaccines. In fact, this systematic review of health misinformation on social media published this year looked at a breakdown of topics where there's lots of misinformation circulating, and vaccines claimed the second spot behind only misinformation about smoking and drugs. Next slide, please. And if you missed out on our fourth Global Infodemic Manager Conference on advancing social listening for public health that happened in May, you can go to the link at the top of this page to access all those talks and materials, including this talk by Professor Johnson, updating on his team's research since our first infodemiology conference last year. And looking here at globally at communities on Facebook, what his social network analysis has shown is that alternative health communities, they appear to be essentially acting as bridges, connecting anti-vax messaging from anti-biotech groups to parenting groups, which may affect their decisions about whether to have their children vaccinated. And so this is an area where more research is also needed to determine whether sowing seeds of doubt about COVID-19 vaccines may also spill over and reduce demand for other routine vaccinations. Next slide, please. Now, this recent paper by Lumba et al., it alerts us to reported drops in vaccination intent in the UK and the US associated with misinformation. And it notes that misinformation is getting more sophisticated, which is especially worrying because they show that scientific sounding information appears to have the biggest impact on intent to get vaccinated. And what this means is that there's a need for more investigation into science-sounding information that may be misleading. So this is a call to action for all of you experts to continue helping to share credible information and to help people understand the difference between robust science versus pseudoscience versus non-science and misleading misrepresentations of science when it comes to vaccines or other health and social measures. Because I think the reality that we're all facing here is that, all of the wonderful vaccines in the world for routine immunization and emergency use, including these new vaccines for SARS-CoV-2, they aren't going to do us a lot of good if they're sitting somewhere on a shelf expiring rather than getting used. And increasing polarization about basic health measures such as getting vaccinated or wearing masks is eroding social cohesion. Next slide, please. So what are we doing about it? How are we advancing social listening to inform the response? Effectively, we're using social listening data gathered by trained analysts at the World Health Organization to develop actionable insights for decision makers. And we use a decision matrix to prioritize what warrants action based on probability of harm, potential severity of harm, potential impact of the intervention, and its feasibility. And we're also testing how to use digital social listening tools, such as the EARS tool I'll talk more about in a moment, to help evaluate interventions as well. Next slide, please. And given the time crunch here, I'll touch briefly on the social listening work. So starting in March of last year, the Information Network for Epidemics, known as the EPI-WIN team at the World Health Organization, initiated a collaboration to develop weekly infodemic insight reports to help detect community concerns and sources of confusion. And the aim was to be able to more quickly identify and fill information gaps using trusted sources to help people know how to best protect themselves and each other, especially before misinformation goes viral. So acknowledging here that, offline social listening is absolutely vital. Knowledge attitudes and practices surveys and focus groups, they have a lot of value. One of the challenges the public health teams have run into is that they can take a really long time to generate results. And by the time those results roll in, people's concerns or their understanding may have already changed. And so what we're seeing here is an advantage where digital social listening is providing a helpful proxy with some faster indicators of changing community concerns to help inform the response. But it's still a really heavy lift for public health teams to manually comb through all of these publicly shared comments, billions of comments, especially during a health emergency. And, trying to figure out a way to save time during a health emergency is something I think we all can appreciate. So we devised a social listening public health taxonomy for COVID-19 with 5 main categories to really help quickly focus in our analysis of 10 different open data sources and fora. So this includes Twitter, blogs, Facebook, Reddit, other online fora and comments, Instagram, product reviews, YouTube, Google Trends data, and other conversations observed online about COVID-19. And there's a paper currently in peer review with details on the methodology, and there's a link at the top of the slide here that I invite you to check out, where Tina, who's here moderating today, has shared more about the methodology for the MIE conference, so that's a good resource as well. And essentially how this is working to try and quickly filter all of these public comments relevant to our taxonomy, how we do this is with a designed Boolean search for these different categories that are focused on narratives around major topics like what is causing the virus. And I'm sure we've all heard lots of conspiracy theories emerging around that topic, for example. Also issues related to COVID-19 illness, for example, modes of transmission, pharmaceutical treatments and vaccines, another big category, interventions, and types of information that are being shared to see how people are responding to the science. And using this approach, we've already produced more than 60 EPI-WIN weekly digital intelligence global reports, infodemic reports, including spotlights on countries. And so far, we've processed 1.2 billion mentions of COVID-19, out of which 959 million of these were directly related to our public health taxonomy. And this includes processing of 61 million posts that were likely to be a question on COVID-19. So that's a lot of information voids. And these infodemic reports then get shared with our colleagues and partners with actionable insights from our analysts to really help target risk communication and community engagement efforts and health logistics for accountability to affected populations. Next slide, please. So this system of weekly reports is ongoing, while in parallel, we are also developing a new tool that is leveraging artificial intelligence and machine learning for automating this kind of social listening approach to get these insights rather than on a weekly basis, to get them in near real time. So these are updated daily. And this includes a pilot that we launched in December, starting in 20 countries, to listen to emerging narratives and questions and concerns using the next generation of our social listening public health taxonomy for COVID-19, which includes 40 categories. And this project is called EARS, which stands for Early AI Supported Response with Social Listening. And it's currently running in 4 languages. We're in the process right now of adding 5 more countries and a 5th language this month. And given the necessary resource, what's really exciting is this could be massively scaled up to many more countries. And it's already providing some helpful indicators for a global perspective and national perspective on emerging topics of interest where changes in communication may be needed. And I invite everyone to take a moment. You can actually go visit the public dashboard right now and have a look at it. So the link there is apps.who.int/ears. And there's also a user authorized backend that has additional analytical features where teams can do a deep dive, look at the publicly shared comments in the raw form. And this is really helpful, this tool, because rather than just focusing on volume of narratives where there's a big spike because there's a lot of engagement, which tends to put comms teams on the back foot where we're always reacting to things. It's able to actually look at what is rising based on velocity. And so it really helps teams horizon scan and identify emerging issues so they can react much sooner and try and be a bit more proactive in terms of communication. And I should say also that in the back end, data from offline studies, which are also really valuable, for example, knowledge, attitudes, practices surveys or SMS survey data, any structured text data can also be uploaded to the platform for triangulation purposes. And we are collaborating now with UN Global Pulse to develop a radio speech-to-text translation tool so we can also better understand narratives in more remote and marginalized communities that are relying more on radio than on online platforms. Next slide, please. So there's this emerging challenge, though, where we really see a need to invest more in research. And the whole point of this social listening program is to better hear the voices of citizens for a more collaborative approach to public health and to be able to make public health programs more adaptive. But disinformation campaigns using bots and fake profiles, they can appear under the guise of genuine citizen concerns and are very misleading. So there's a need for more investigation into the major drivers of disinformation campaigns, including identification of deep fakes. And there's a need for digital platforms to address fake profiles that are created with malicious intent. Next slide, please. And I'll share a couple slides that Matt King from Murmurit presented at our 4th Global Infodemic Management Conference on 11th May. You see the link here. You can access all of those talks and resources. Next slide, please. And here's a question for you. So everyone make sure you're logged into menti.com, use the code 42183067 and answer the question. So looking at these profiles, let's toggle back to the slides for a second, Miriam, to give everyone a really good look. So look at these 6 profiles, and I want you to look really closely, maybe magnify it on your screen, and tell me which of these profiles is fake, and then pop your answer into Mentimeter using the number identifications on the photos. We've got photos 1, 2, 3, 4, 5, 6. Which of them is fake? All right. Getting a nice long look. Decisions. Okay, should we head over to Menti and see what people have shared? Okay, some people are saying it's number 3, number 1. Oh, a lot of people think 1 and 3 are especially dodgy. A couple of people saying all of them. 1, 3, 5. More for number 1. Fake. Someone thinks number 4. Yeah, what we're seeing here is a big split actually across almost all of the photos. It's quite difficult to tell, isn't it? Okay, so let's go back to the slides. And next slide, please. Drum roll. Here's our answer. Are you ready? So in fact, they're all fake. So a couple of you guessed that. Well done. They're all fake, but it's incredibly difficult to tell. Next slide, please. And one of the tells for everyone to keep in mind is that these manufactured profile photos, they tend to still have some distortion around the ears. For whatever reason, there's still a lot of difficulty for making it quite as clean around the ears. So that's a good tip to keep in mind. So when you see profile photos and you're wondering if it's a legitimate account or not, maybe have a zoom in and look around the ears. But for thinking about this challenge on a larger scale for disinformation, candidly, we're really only seeing the tip of the iceberg of information warfare. And this is not only a threat to health security, it's we can go back to the previous slide. It's also a major threat to national security and to global peace and prosperity. And biological warfare, it's already on the radar as a major threat. And now we're also in an era where the digital communication ecosystem itself can be weaponized to slow down countries' productivity and their economy by undermining the public health response without ever having to release a biological agent. So I think there's a need to increase resource in terms of addressing the challenges that come with disinformation. There's a need to investigate attempts to undermine particular vaccine brands. There's a need to address the risk of increasing cyber attacks with ransomware targeting hospitals that may be already overwhelmed by COVID-19. There's a question now of whether hackers may already be creating fake vaccine registration links as a way to access personal data and share worms. So we need to work together to build a healthier communication ecosystem, investing in education for science literacy, health literacy, digital literacy, and media literacy, and address all of these emerging threats to health security. Next slide, please. Even though the World Health Organization is extremely active in developing the science of infodemiology and the practice of infodemic management, the reality is that we cannot do this alone. So this needs to be a whole of society approach, and we need all of you. So we just closed the deadline in May for applications to our second global infodemic manager training, which includes epidemiologists, behavioral scientists, risk communication experts, and more. But I'm happy to share, given the overwhelming demand for the training, we had applications, nearly 1,000 from 114 different countries, and we have limited spaces for each training. So given this incredible growing demand, rest assured there will be more trainings to follow. So make sure you watch our infodemic webpage and sign up to our newsflash to get all the updates. We can go to the last slide. And in closing, I encourage all of us to become infodemic managers in our daily lives as champions for science and for truth. So I would encourage everyone to take 60 seconds right now, go to the Sign Our Call for Action page, share on social media using the hashtag infodemic. And this is also a call to action to universities in Europe and worldwide to integrate infodemic management into your curriculum, and for European research institutions and health authorities to incorporate infodemiology into your programs so we can apply the best emerging science to better manage infodemics for global health. Thank you.